Welcome to our video about DELTS 2, Dementia Education and Learning through Simulation 2, a training toolkit for staff working across health and social care and with people living with dementia. The work was originally developed by Health Education England in 2013-14. By the end of this video, you will know more about DELTS 2 and understand how this can make a difference to your practice to improve the delivery of care for people living with dementia.
The DELTS Toolkit is aimed at trainers delivering training to staff working in a hospital setting looking after people with dementia. It's called a train-the-trainer model. The DELTS Toolkit has a variety of simulation tools to encourage people to understand the lived experience of dementia. The toolkit brings evidence into practice, and it's been quality assured and meets the requirements of the National Health and Social Care Training Framework.
The simulated learning approach means that staff consider experiences from the point of view of a person living with dementia. Placing staff into the shoes of a person with dementia helps staff to understand the impact that dementia can have on a person. The simulation activities in the training are designed to be easy to use and low cost, so that as many trainers as possible can make use of the materials. The simulation activities can be adapted to be relevant in different health and social care settings, including people living in care homes and nursing homes. It can be used alongside existing training resources that hospital trainers have access to.
In 2017, we delivered training sessions to 200 trainers nationally across England, and those trainers were based in hospitals. The aim of the training sessions was to enable the trainers to feel confident in using the DELTS 2 materials within their own dementia training. Our evaluation data shows that trainers were satisfied with the training toolkit and felt confident to use the simulation approaches in their own dementia training. 12 months after the training, trainers' knowledge of dementia had increased significantly in all 6 topic areas covered by the training, and many trainers were using the DELTS 2 simulation activities in their own training.
In response to the COVID-19 pandemic, there's a real need for health and social care staff to access dementia training materials. Having these materials available online mean that people can access these at a time that suits them and their organisation's needs. Post-COVID-19, we also feel that having different options for training delivery will help to ensure that we can reach different staff groups more effectively.
We're currently developing an e-learning version of DELTS 2 that can be delivered online through programmes such as Teams and Zoom. There's a requirement to adapt the existing DELTS 2 toolkit to ensure that trainers are supported in being able to deliver the e-learning version of DELTS 2 online. As part of this piece of work, we're also looking, as part of our evaluation, to capture the thoughts of staff that are attending the training and to hear about the ways that the training may have improved their care for people with dementia. We're also working with a number of care providers to adapt the training materials and understand how they can improve the care for people living with dementia in those settings.
And we have been working with the University of Bournemouth in developing the e-version of the DELTS dementia programme.
We've already trialled 2 sessions of the training, 10 participants to each session, which was really well received and well evaluated. And this is also going to be embedded in our Caring for People with Dementia in Hospital Study Day, which is coming up in November. And also the training will become mandatory for Band 2 and 3 healthcare support workers and preceptorship nurses and our compassionate care volunteers, and also be offered to anybody that is interested. So I think it's only can be positive that staff have got the opportunity to have Tier 2 dementia training now.
What we plan to do is to offer the eDELTS programme as an alternative to a face-to-face programme. We hope one day to be able to get that face-to-face programme back in place. The DELTS 2 training, the eDELTS training, allows the opportunity for people and for practitioners to basically reflect on what they have learnt and how that does impact in their practice, and how those practice that practice can change, or that practice could be adapted.
When I've been out onto the wards working alongside the staff, they've suggested that real person-centred approach, even though it's been via Teams, virtually, has really come across and still enabled them to actually consider what it's like to be living with dementia and being in hospital. So yes, lots of positive feedback. Of course, there are some staff that would say face-to-face is better, but I think this is actually still giving people the opportunity to still feel that they're being involved and have got the opportunity to learn and work together and discuss the difficulties and positive experiences they have.
That's where I think something like the eDelts works, because it allows people through simulation to actually try out activities to almost kind of strengthen the argument that is being given from the theoretical perspective.
The DELTS 2 Toolkit is available to download for free from the Health Education England website. For further information about DELTS 2, please contact the Ageing and Dementia Research Centre at Bournemouth University. Thank you for watching this video and hope you found it helpful.